and welcome to Ask CPS. For this session, we'll be talking about respiratory diseases, in particular tuberculosis, because it is World TB Day on the 24th of March. And today's speakers are Dr. Mike Mercure and Dr. Sana van Kampen. Thank you very much for joining us.
You're welcome.
Hi.
Dr. Mercure, let's jump straight into it with a bit of background to TB and other respiratory diseases. Generally, do we see many cases of TB here on the island, as well as additional respiratory disease?
TB is probably one of the less common respiratory diseases we have here. I don't have figures from the health department, but if I look back in my own practice, I might have maybe one patient in a year time, in every year at most. So it's not very common. The most common one, on the other hand, would be asthma. And asthma is rather common. And then the next one would be COPD. Depending on the age of the population, COPD will be more common. It's more common in the older population, and asthma more relatively young. Asthmatic is just like the rest of the world, moving from a younger to older population. So in the 20 years that I practiced, I probably saw a lot of young people with asthma, and I probably see now a lot of older people with COPD. That's it for as far as the major respiratory diseases, COPD and asthma, and the distant third would be tuberculosis.
Okay, so let's stick a little bit with TB for our listeners. Could you give us a bit of background to TB? What's the cause, and how would I know if I had TB?
TB is caused by a bacterial infection, and it's an infection into your lungs. So the most common route is through the air that you breathe, and you get it from somebody who has it in their lungs. That person coughs. When the person coughs, he moves some of the bacteria from the lung into the air, and you breathe in that air, and then you get tuberculosis infection in your lung. That's in a nutshell what happens. So it's a lung infection that comes through the air. And your second question is a bit more difficult. Quite a few people get TB and don't even know it. They don't get much symptoms, and a smaller percentage does get symptoms. And then the most common symptom probably would be cough, fever, tiredness, those type of symptoms, roughly speaking. But a good part of people who get infected actually do not show any symptoms. It also depends, again, which population you have. If you live in a country where there's a war going on and people are malnourished, quite a few more people will get symptoms. If you live in a country where people are in a good state of health, less people would get symptoms. So it depends. But in our area, probably most people are well nourished, well rested, so you would have less symptomatic cases. But if anything, if you cough, you sweat at night, and you feel tired, and the cough doesn't stop, have it checked.
Okay, and what are some of the treatments that anyone could expect if they were infected with TB?
Right now, it's usually the usual regimen is 6 months of 3 or 4 tablets. That's what I've had with my recent patients. The diagnosis could be tricky. It's not so simple, but once a diagnosis is established, it's usually 6 months of tablets. And
let me just ask you about, so we've covered some of the causes, some of the manifestations, and how we might treat it. But what are some of the long-term problems of TB?
Tuberculosis, most of tuberculosis is in the lungs, and it will damage lung tissue, and it will render some parts of your lung tissue non-functional. It cannot do the function anymore. And that might be the source of chronic infection, because non-functional lung tissue is easier to get infected, and then you might get, even if the TB bacteria is gone, you might be more prone to any other lung infection. So probably there is a risk of developing a situation whereby you lose some capacity, but also you lose some defense. Your lungs become less resistant to infections, and that could be snowballing, like over time, because you get another infection, you lose another piece of lung function, even if it's not by TB, and your resistance get less and less and less. So it is it could have serious consequences on the long term, and I'm talking about in 10-20 years time.
Dr. Van Kampen, I know that you've spent some time in the field working on TB. What does your experience tell you about TB, how to best manage it, and how to rehabilitate patients?
So when we are referring to chronic problems after TB or post-TB lung disorder, as it's called, it is quite common, and it's often flagged by clinicians throughout the world that they see many ex-TB patients who fully recovered continuing to have these long-term respiratory problems. So the estimates of how common this is vary, and I was involved in a large study in Uganda where about 16% of people with TB developed some form of chronic lung disease. This could become COPD or bronchiectasis or fibrosis. It is often undiagnosed because many low and middle income countries do not have the services to deal and manage COPD type problems. But in any case, there are ways to manage the disease, even though some pharmaceutical interventions like bronchodilators or other types of medicines are not available. And that is, for example, by a program called pulmonary rehabilitation, so where people are monitored and guided by a physiotherapist to do certain exercises, and they get some education on how to cope with their long-term chronic lung disease. And this seems to work very well for post-TB patients, and it's also very effective in COPD and asthma patients. So it basically consists of exercises to increase your general fitness, your strength, and your endurance. And this is proven now to be very effective.
So I want to bring back into the conversation Dr. Mercure at this point to talk a little bit more about COPD and asthma. So are these particularly common conditions here on St. Martin? And if I had asthma, how would I go about treating myself?
Yes, COPD and asthma are rather common conditions, especially asthma more so than COPD. I don't think the prevalence here is more than it would be in any other developed country, so we don't have more of it or less in it. But it's one of the common ailments you encounter in medical practice of a GP. Most of the patients since it's a chronic condition, most of the patients, after they develop the condition, so to speak, they remain in a chronic state, and most of the time it's follow-up for prescriptions. The most common treatment of asthma and COPD that we as GPs provide is the use of inhalers. Yes, that's the most common treatment. So quite often you have patients coming, can I get some more of my inhaler? Can I change an inhaler? Can I better an inhaler? But that's the most common way we go about with COPD and asthma. And sometimes we do make referrals to evaluate the lung function or re-evaluate the lung function, and or an assessment maybe twice a year by a pulmonologist.
So as we come to the end of this session, I think what we're going to do for the next session is talk a little bit more about treatments and causes and treatments of COPD. We'll also touch a little bit on COVID-19, as we know that's a respiratory disease, and touch on whether COVID-19 might cause COPD. And given the numbers in our population, and indeed across the globe, how we might start to manage these, perhaps the chronic conditions that might be associated with people who have recovered from COVID-19. So we'll be back shortly. Stay tuned.
Hi. So, in the last video, we explained what is a vaccine and how it works. But do you know how it's developed? Every vaccine is developed following the same steps and stages. Pharmaceutical stage. When the genetic code for the virus becomes available, scientists can start to develop a vaccine. Preclinical stage. In this stage, the vaccine is tested in a lab, on human tissue, and if that works, on animals, to see if the response is the same. Clinical stage. Phase 1. The vaccine is given to a handful of volunteers. In Phase 2, it's given to hundreds of volunteers in different doses. In the last phase, the best performing dose will be given to thousands of volunteers. License stage. This stage looks at the previous results to determine if it is safe for the general population. Serious side effects are not accepted and steps cannot be skipped. The requirements for a vaccine to be approved are very strict and the same for all vaccines. When approved, a vaccine is therefore considered just as safe as all other vaccines. If approved, the vaccine can be produced and distributed. However, the safety is always monitored, even when the vaccine is already on the market.
Hello and welcome back to Ask CPS. In this episode, we're talking about respiratory diseases. In this session, we have Dr. Sanne van Kampen and Dr. Mike Mercure, our two guests today. So I'm going to go straight back into it and ask Dr. van Kampen a little bit more about COPD. We mentioned it in the previous session. So do you know what the prevalence is roughly worldwide? Is it a major cause of disease and health problems across the globe?
Yeah, in fact, COPD is currently the third leading cause of death worldwide, and it's rising every year. So it's really it wasn't on the top 10 even 10 years ago, and now it's on the third place. So every year, about 2.5 million people die of COPD. And it used to be a disease that was mostly prevalent in the richer countries. It's mostly linked to smoking. So that's the main cause of people developing COPD. But over the years now, it's become more and more prevalent in also low and middle income countries. And that's mostly because of air pollution. So both outside of the house from traffic and industries, as well as inside the house because of people's cooking on cook stoves, and that's of course mostly in rural parts of the world. That's a very big problem. So pollution is now the biggest cause of COPD.
And Dr. Mercure, you know the situation well here on St. Martin, having been a GP for the best part of 20 or 30 years, dare I say?
20-something.
20-something years, okay. So you know the situation well. We know we've also got COPD on the island. What do you think are some of the major causes of COPD here within this population?
Well, as Dr. Kampen said, smoking is probably still one of the major causes. But also we've seen an increase in environmental pollution globally. We've been spared industrial environmental pollution because we have no industry. But we have a dump in the middle of Phillipsburg, and that takes its toll on the pulmonary health. I jog every day on the beach, and there are some days that I have to cut it short or have to avoid certain area because I can smell the dump, and I refuse to inhale that air. So we do have environmental pollution here in St. Martin, and it definitely has an effect. I have patients that got admitted because of that. So yes, I guess as the world gets dirtier, unfortunately, there are going to be more COPD. Besides, even the people who don't smoke going to get exposed.
Another respiratory disease that we've all been living with and in amongst is COVID-19, of course, been with us since February, March 2020. It's changed our lives dramatically on the island and lives of those in other countries all around the globe. Dr. Sana van Kampen has been working diligently on the outbreak since, I believe, July 2020. So how has that transition been for you, Sana, from TB, COPD, and now working on COVID-19? And how has your experience been here on St. Martin so far?
Thanks. Indeed, I arrived last July, just before we saw second wave of COVID here in St. Martin. Well, I think there are many parallels to the previous work I did in respiratory diseases, especially when we look at the diagnostic and management of the disease, but also from an epidemiological point of view. Yes, we see a similar pattern as for other infectious diseases. The epidemic on St. Martin, yes, we've seen a few waves, a few outbreaks, and an increase in the number of cases. But overall, it's been going very well. So at the moment, we are at an all-time low in terms of number of cases. I think that's mostly because the general adherence to public health measures is good. So people do wear their mask and wash their hands and keep their distance. So that's very positive. What's also very positive is that we've seen very few hospitalizations. So people ending up in hospital with COVID, the numbers are very low. And so unlike other parts of the world, like Europe and the US, where the healthcare capacity is really the main bottleneck, we don't have that problem as yet on St. Martin. So that's really, really positive. Of course, there are still cases. We have to keep adhering to the measures, as we've seen over the holidays. There's always a risk that when people get together for festivities and lax a bit in what they do, there is suddenly an increase in cases again. So we must remain vigilant. And of course, with the vaccines now having arrived on the island and the campaign being in full swing, the most important thing that we can do now is get vaccinated.
So that's a nice segue into vaccines, because that's where I would like to take this conversation. It's the word that's on the tip of our tongues at the moment. Vaccines are a crucial way to mitigate the spread of disease and also lower the risk of severe symptoms. So I'd like to go back to Dr. Mercure at this stage and talk a little bit more about the vaccine. Dr. Mercure, one of the questions that I often receive from members of the community is, can I take the vaccine if I have comorbidities like hypertension, asthma, and all of these other diseases that are prevalent on the island?
It's quite interesting. I get the same questions. It's actually the opposite. The comorbidities should make you run to get the vaccine, because those comorbidities put you at a high risk of developing serious COVID. And there are hardly any indications why you should not get it. But some way or the other, in quite a few patients' mind is actually turned around. They say like, oh, I have a terrible lung disease. Maybe I should not get the vaccination. Whereas it should be, oh, wow, I have a terrible lung disease. Thank God I can get a vaccination. But yes, indeed, we have quite some comorbidities in our society, and not much as much lung disease, but a lot of hypertension, diabetes, obesity, and lung disease is just another comorbidity. And yes, we should be very glad that we received those vaccinations, and we should take the opportunity to get it. I myself got vaccinated on the first day, and I got my second vaccination already. And it's very important, not only for people with lung disease, but for anybody to get vaccinated so we can get herd immunity and get this behind us.
Some people might be worried about the side effects with the vaccine. Could you tell us a little bit about what to expect when, if I were to take the vaccine, for instance, and how many doses it would require and the length of time between those doses?
Right now, the only vaccine that's available here is the one from Pfizer. Pfizer is a 3-week interval between the first doses and the second doses. I received both doses already. The only side effect I had was a little pain in the site where I got injected. That is about a possibility of 85%. I don't have them by my out of my head, but about headache is, I think, in the 55% chance that you might get headache for 1 or 2 days. Fever is around the 40%. Body ache, muscle ache around the 20%. So if anything, you could get, most commonly would be pain where you got the needle in your hand, but that has nothing to do with the vaccine. That's with any vaccine. And the other effects that you might have is like flu-like symptoms, which could be headache, fever, chills, fatigue. And that's ranged between 60 and 30%. But I was lucky; I got absolutely nothing except for the injection pain on the injection side. But there's no significant reporting of any severe effect of COVID, and any effect that you would get would be temporarily, maybe 1 or 2 days. But absolutely no reason not to take it. Absolutely.
And Dr. Van Kampen, well, I know that we're quite short on time at the moment, but just very quickly, I know that you are helping with registration. How are the numbers looking at the moment, and what can we do to try to encourage people to take their vaccine, in your opinion?
Yes, at the moment, I think we're looking at around over 8,000 people have registered to get vaccinated, and almost 3,000 people have now been vaccinated. So anyone can get registered. It depends on the priority group that you're in when you will actually receive the invitation. But at the moment, we invite everyone over 60 and with underlying medical conditions to register as soon as possible, because you will receive your vaccine quickly. Yeah.
And there we have it. So thank you very much to epidemiologist Dr. Sanne Van Kampen, local GP here on St. Martin, Dr. Mike Mercure, for joining us today on this episode about respiratory diseases and vaccines. Thanks again, and stay tuned for the next episode.